weeks ago, my sister had a little baby boy named Owen. Our family was overjoyed to have a new little buddy running around. However, our joy and excitement quickly turned to worry when Owen was put in the neonatal intensive care unit, also known as the NICU, in the hospital, due to respiratory problems. Pictured here is Owen in the NICU. As you can see, he has many wires and machines attached to him, and as you can also see, he probably needed a lot of attention. Can you imagine being a mother and having your new little baby taken away from you by doctors because of a serious issue? It can be scary even as a family member to watch all of this take place. According to the National Association of Neonatal Nurses, approximately 40,000 low birth weight infants are born annually in the United States. My family quickly learned that our little Owen was in great care with the NICU doctors at the hospital. Neonatal intensive care unit doctors are highly trained doctors that specialize in taking care of newborns with serious medical issues. According to the NICU Nursing Career Center website, according to the U.S. Department of Labor, the registered nursing profession will experience a 26% growth until at least the year 2020. As you can tell, neonatal nursing is a very growing and important profession. These doctors are greatly looked up to and they hold a high position in the medical field. However, it is not an easy job to obtain, and the job is never a breeze. To become a neonatal nurse, one must obtain a fairly large amount of schooling and education. The first step of schooling is to attend an accredited school of nursing to begin attaining a degree. A nursing degree can be obtained through 3 different routes. Number 1, a diploma degree. This is the lowest degree. It can be obtained through a hospital-based school of nursing. Number 2, an associate's degree in nursing can be obtained with 2 to 3 years at a community college. This is the next best degree that you can obtain above a diploma degree. Number 3, a bachelorette degree is earned through a college or university and generally takes 4 years of schooling to obtain. This route gives the most flexibility in your future career. Going this route of schooling will allow you to become an RN, also known as a registered nurse. Then, to specifically become a neonatal nurse, you will have to take a certification examination. To take a certification examination, one has to have been employed and had over 2,000 hours of specialty experience within the last 24 months. There are also 3 main levels of neonatal intensive care for which these nurses can work within. Level 1 nursing is generally a nursery with healthy newborn babies. Level 2 nursing is generally a nursery with intermediate or special care and is generally for premature or ill babies. The demands of these babies in a nursery that is level 2 may include supplemental oxygen, intravenous therapy, special feedings, or extra time to mature before going home. Level 3 nursing is nursing for babies who need intensive care that level 1 and level 2 nurseries cannot provide. These babies in level 3 nursing may be very premature, extremely small for their age, or ill. Lower level NICU nurses will work with and monitor 3 to 4 patients at a time. Level 3 NICU nurses will either be one-on-one with a patient or 2 patients per 1 nurse. There are many things to expect after becoming a neonatal nurse. It is a tough and busy occupation and there is rarely a moment to rest, but it is rewarding. Nurses are responsible for total nursing care of infants who may be diagnosed with congenital effects, delivery complications, or most often premature infants. NICU nurses are also expected to comfort patients, educate, and reassure parents. On a normal day, neonatal nurses administer medications, perform procedures, work with complicated machines and technology, and consult with healthcare teams to coordinate all aspects of the patient's lives. A normal workday is around 12 hours for a neonatal nurse. However, some hospitals will allow 8-hour workdays. There are many things to expect if you obtain a job in the NICU. Crying infants, many busy doctors, beeping machines, ancillary staff, specialists, therapists, administrators, and family members make for a busy work environment regardless of the level of the NICU. The median year salary in 2010 for registered nurses was $65,000. although the salary can range anywhere between $44,190 and $95,130. Overall, neonatal nurses have large responsibilities and they do some of the most critical work in hospitals. Neonatal nurses save and help the lives of millions of newborns every day. These nurses work hard to get their education, and they work even harder after they obtain a real job as a registered neonatal nurse. In the end, it's all worth it. Being a neonatal nurse is one of the most rewarding jobs because you get to save many lives that are just beginning.